Hi, I'm Dr. Nicole Anderson, and I'm going to show you a simple sequence of things to do that doesn't require any equipment to improve neck mobility and decrease neck pain. So first, just check out your neck mobility. Okay, so you're just going to look over your shoulder like you're looking for something that you dropped on the ground right behind you. Check it out both sides. You can just spin your head side to side, checking out that mobility. You can move your head side to side. All right, I've assessed my mobility. Now what I'm gonna do is take my fingertips and I'm just gonna do some circles at the base of my skull. Okay, so that's gonna be just right above your hairline. Just doing circles, it does not have to be hard pressure, just go easy. And the whole point of this is that we're stimulating glycosaminoglycans and fibroblasts, which are part of your connective tissue matrix to help pull fluid into that matrix so the layers can slide and glide better. Because a lot of times people can't move their neck very well because the soft tissue layers have become like beef jerky. They're real stuck together and gotten not very well hydrated. And so they just need to be hydrated so that people are able to actually move their neck with ease. Okay, so then the next part that we're gonna do is take your fingertips and we're just going to do some circles right along your jaw, like this, and then right along your cheekbones, like this. By the way, this is a nice little facelift effect, making you look nice and young and loosening up some of those wrinkle lines. Okay, then we're going above the ear. For some of you guys, that's all the motivation you need to do this. Okay, and then next I'm going to the base of my skull again, circles. Okay, all right. That was it. Very simple. Okay, now I'm gonna check my range of motion again. Oh, wow. Definitely got looser. Definitely got easier just from doing that little bit. I don't know about you, but that was easy and I feel better. Okay, now I'm gonna train that new range. So what I'm gonna do is I'm gonna stand and with my eyes, I'm gonna look to the right and then I'm gonna look over my shoulder, tilting my ear so that I'm looking to the floor right behind me. Okay, and then I'm gonna come back to the middle. I'm gonna do that 10 times in a pain-free range of motion. Then I'm gonna go 10 times to the other direction in a pain-free range of motion. That's gonna help, that motion's gonna help with the mobility of your neck in all different planes of motion, okay? Do that 3 times a day. You don't necessarily have to do all the juicing up 3 times a day, but at least do that mobility 3 times a day. Do the juicing up maybe once a day if you have a sore neck, or if you're trying to improve the mobility of your neck, okay? If it's painful, when you take your head and move it, and right at the end, maybe it's painful or you're limited how far you can go, then don't push through the pain, just go up to the point of pain, and then the next rep, do a little less, okay? Do a few reps like that in that pain-free range, then test it again. You might be able to go a little bit further than after you've done a few reps, because sometimes the body just needs to juice up the joints a little bit through movement, and you'll be able to go further the next time, all right? Please reach out if you have any questions about any of this, and thanks for watching.